Hi, my name is Alyosha Jacobson. I'm a psychiatrist. My particular area of interest is in trauma. So I'm just interested in treating and diagnosing and assessing people that have had trauma at work or trauma as a child. And I've had specific training in that area. So I work both clinically treating patients and also doing medical legal assessments. In my treatment, I'm focusing quite a lot on people that have had childhood or adult episodes of trauma. In my assessments, I'm trying to use some of that knowledge to be very empathic, very careful, very aware of your emotions or my patient's emotions, and make an assessment about what kind of injury you have, what the diagnosis would be, and how that's affected you, and then to help your referrer to work out what kind of ongoing support you need. Well, I've always been interested in psychiatry. My father's a psychiatrist, so I think that's in my blood. And I like helping people, and I like listening to people. I like thinking about how people's feelings work and what's going on for them, and seeing if I can help. So I see people with most psychiatric diagnoses. The most common ones would be depression, anxiety conditions, PTSD, complex trauma, which is childhood trauma, adjustment disorders, personality disorders, really all kinds of psychiatric conditions. So my job is to support the referrer by trying to get a psychiatric diagnosis, which is a medical diagnosis of what's happened and what impact it's had, and to really clarify the degree of severity, to clarify how it's affected you in different aspects of your life, to think about whether it's a permanent condition or whether there could be further improvement. So my job is to help the referrer work out what to do next. So to have a clear diagnosis, a medical diagnosis of what the psychiatric injury is, to have clarity about whether it's permanent, about whether the person has reached maximal improvement or not, and to have clarity about the severity of the injury, what areas it's impacting on, and then for the referrer to know about where to go to from here in terms of support. I've seen people from all different industries. Of course, I've seen people, of course, that are not employed. I've seen people that have had injuries in manufacturing, in the medical area, in nursing, in education, in police or emergency services, in every area, working for government. And I think I have some understanding about how a workplace can lead to injury in very obvious ways or sometimes more subtle ways. I have been working in clinical practice now for 11 years, and I've been seeing patients as my main job, treating them. And a lot of what I treat are patients with complex trauma, and I do psychotherapy also. And I've also had particular training in treating, diagnosing, managing complex trauma through the International Society for Trauma Dissociation and supervision around that. And I've also done courses with PTSD specifically. So I'm quite familiar with treating, managing, diagnosing and assessing PTSD and complex trauma, as well as all the other typical psychiatric presentations. I work at St John of God Hospital in Burwood, which has got particular expertise in PTSD, and also has inpatient programs for PTSD and for other conditions, including anxiety, depression, and personality disorder. So I think I bear a good understanding of these conditions and how they affect people from a longitudinal perspective, not just a cross-sectional one-off assessment. Well, I've seen lots of people that have had assessments that have been really traumatic, where they've found them very unsupportive, very stressful. They've found the assessor to be cold or hostile. And in fact, I am quite an empathic person. I want them to feel like I really heard them, that I was open to everything that they said, that I listened to everything that they thought was important. And I want them to feel like I was fair, and I'm going to do a fair assessment, and I'm going to hear everything that they said. And I think that the last thing is I don't want them to find it an agitating experience. I know that they often come with a lot of apprehension, but I'm really going to focus on making it as less stressful as possible. I want it to feel like an okay experience for this patient. I want to offer I want this to be a non-traumatic experience. I want clients to feel that they are not being damaged by this whole process of getting assessed. I want them to feel like there is someone who's on their side, who's listening, but is also being fair. And I love seeing patients. I find their stories really touching, and I want to be able to support them. I want it to be not a difficult experience, and one where we really get all the information we need, and it feels like it's been okay for the person.